Okay, I think we'll go ahead and start. I know it's a minute or two early, but for those of you anxious to get back to the football game, we'll keep it moving. I don't forget how this started out, but I have said that I would tell a joke before I get started. And so in that tradition, I actually did find a couple. The pastor shared one with me, but I can't tell it to you in church. So the first one's actually a question. What happens if you get scared half to death twice? Think about that. This is a piece of advice. If at first you don't succeed, skydiving is not for you. Yeah. And my mechanic told me he couldn't fix my brakes, so he made my horn louder. So just be careful out there when I'm driving along. Okay, so a little humor never hurts, and that is very little. But anyway, so we're going to talk about anxiety. I notice every time that Kurt tries to tell us about that, he says, "No, this doesn't affect any of you." But some of you have told me otherwise, that it is a big problem. And I think it is timely, though it's accidental. I planned this long ago. But having these hurricanes and the drastic things that has caused in our community has really raised the anxiety level quite a lot, for some more than others. And there's a new term that I just recently learned from the psychologist. It's called, it's a type of anxiety that they relate back to what's going on in politics. So they call it political anxiety, and that's very high right now for a lot of people. So we're sort of being inundated with anxiety-causing things. Now, originally, I was just going to talk about anxiety disorders, because that's kind of what I do. But given the amount of anxiety that's floating around here, I'm going to also talk about what I'll call everyday anxiety. So you don't have a disorder, but you're really anxious about something, and something understandable. So I wanted to kind of talk about that. So let's start with the first slide. So having anxiety is normal. It's a normal process. It's built in to protect us. Back in the cave days when there was a saber-toothed tiger hanging around, if we saw the shadow, we would become anxious, and it would happen in less than a second, actually a very small fraction of a second. Part of the brain called the amygdala lights up and it says, danger, you've got to do something. You either have to run or fight or freeze to save your life. And that's the same mechanism that fires off whenever we're anxious or afraid about anything. It's a sort of a perception of danger. And it feels bad, but it is potentially life-saving. But we can have the exact same reaction when we just don't do well on a test. So it's very common. It doesn't feel good. And sometimes it's very severe, so it almost reaches the level of what you would call it a disorder. And that's really bad. Next slide. In fact, sometimes we can feel overwhelmed, and that's if the stressor, the trigger, is extremely significant, or if we have multiple types of stress. So what I mean by types of stress is what it is that is stressing us. So one common type would be performance stress. We have a test coming up at school. We're getting an evaluation by our boss. We'll determine we get a raise or not. We have to get up and sing in front of other people or give a talk like this. In fact, I'm told the number one anxiety is public speaking. Number two is talking in a restroom. So the most anxiety is if you give a speech in a restroom. So just be careful with that. So types of stress. Obviously, if your health is in danger, you're going to have surgery, you find out you have cancer, you are sick in some way, that's very anxiety-provoking. Financial stress, very, very common, of course. Relationship stress, you're struggling with your partner, breaking up with your girlfriend, what have you. And then school and work are two also common causes of stress. So you can easily picture yourself having multiple forms of stress for multiple reasons, and it can all add up and overwhelm you. Now, typically we think that stress is triggered by something, but you can have stress without any apparent trigger. But sometimes there is a trigger, you just don't know what it is. And I'll give you a personal example. Years ago, when I was seeing patients in a family medicine office, and I was going into the cabinet we had to get some medications for a patient, and I noticed that I was feeling very anxious. My heart's pounding, I'm kind of sweaty and shaky. I'm thinking, what am I anxious about? So what I did is I sort of ran through those things. I said, well, any relationship problems? No. Financial trouble? No. Couldn't think of anything that triggered it. And then as I'm reaching for the medicine, I realized, oh yeah, this morning I had some congestion. I took an oral medicine that had a decongestant that acts as a stimulant, and that's what I was feeling. And I thought it was anxiety. So this is a good example of a medical cause of anxiety. And sometimes you don't know that a medicine you're taking can cause an anxious feeling or a depressed feeling. And that's one of the things that in psychiatry we're very concerned about. When someone comes in with a complaint about a feeling state, they're anxious, they're depressed, they're confused, whatever, is this caused by a medical problem, like a medicine they're taking, or they have pancreatic cancer and it's showing up as depression and so on. So that's very important to identify. And that's the reason that psychiatrists are first medical doctors. You go to medical school and do residencies that includes general medicine and neurology and the like. Okay, next slide. So what do? Self-care is very important. You need adequate sleep. You need to eat properly. You need to get exercise. You're all taking care of yourself. Whatever medical issues you have, take care of them. See your family doctor, what have you. That's extremely important because when you are anxious, it's also a stress response, which means you're producing adrenaline, which is what increases your heart rate and makes you tremulous and sweaty. And you're also producing cortisol, which is preparing you for a danger. But if there is no physical danger that you have to address, you don't burn up the cholesterol or the cortisol, and that is bad for your immune system and bad for you if it goes on for a long time. So self-care is extremely important when you're dealing with anxiety. Some people feel better when they are having anxious feelings and they restate it as being energized. I'm feeling energized rather than I'm feeling anxious. If you say to yourself, I'm being energized. Some people find it's easier to handle the anxiety. That only works if it works at all, if it's mild though. And that reminds me, there is no treatment for anxiety that works for everyone all the time. So you have to have a whole lot of different ways of dealing with it because what works for him may not work for her and so on. And it may work for you now, but it might not work the next time. So you need a lot of tools in your toolkit to deal with anxiety. One of the things that is very powerful is to begin noticing your thoughts. And this will get us into cognitive behavioral therapy, which I'm going to discuss more when we talk about pathological anxiety, but it applies to any ordinary feelings as well. A lot of what we feel emotionally in the here and now is either caused by or at least heavily influenced by what thoughts we're having. They're called cognitions. And you can learn to notice what your thoughts are, notice if they are rational thoughts, if they're making sense, and if they're not, then how do you correct them? And that will also then help to reduce your anxiety in this case. But we'll go into a lot more detail. And by the way, in preparation for this, I came across somebody bothered to do some research. How many thoughts do we have in a day? And you might wonder, well, is it 100 or is it 1,000? It's 60,000 thoughts a day most of us have. This is an average. And if a lot of them are negative thoughts about yourself, the world, or the future, no wonder you might feel anxious or depressed. So you want to begin paying attention to your thoughts and see if they're helping to drive this anxiety. And if you have them, you want to challenge them, and we can talk a bit more about that in a moment. So next slide. So here are some examples, and there's examples of negative thoughts. There are probably 50 of them. One would be catastrophizing. Another way to say it is making mountains out of molehills. So what's really a small issue, you get magnified in your mind as if it's the end of the world. So the student who has just failed her first English test thinks that, well, this is it, I'm going to flunk out of school, I'll never amount to anything, I might as well just hang myself. That's an exaggerated, but that's catastrophizing over a little thing, right? The next one is similar, it's magnify and minimize. What that's referring to is anything that's negative and bad and challenging in your life that you think of yourself, you magnify it. You make it bigger and more important than it really is. On the other hand, the positive things, your talents, the things that are going well in your life, the things that you're happy about and pleased with, you minimize, like, well, that's just nothing. So some people tend to do that, and that puts you in a position to be depressed or anxious. Labeling is another common one. This would be, for example, if you're on a diet and your favorite pie is, banana cream pie, and you're somewhere and they're offering some to you and you couldn't resist, you eat a piece. If what you say to yourself is, I'm such a pig, you've just labeled yourself as being a pig, which you probably aren't unless you oink a lot. So it's not a rational thought, the kind of labeling, but it can make you feel bad. So those are enough examples so you get the idea of the negative thinking. Next slide. So when you're having thoughts that you can recognize as being negative, you really want to know factually whether it's valid and true. And you start with, if you can, you name the type of thought. Oh, I'm labeling myself. Oh, I'm making a mountain out of a molehill. Oh, I'm engaging in magnification and minimization, whatever it is. And then as you can learn what sort of techniques there are to counteract them. And if they're really bad, then that's where seeing a cognitive behavioral therapist comes in, because that's their expertise, is in recognizing and what do you do about, how do you shift your thinking if it's negative thinking that's not rational and real. So asking yourself about it, if you need, in case, is it true? Is it true that I'm a pig because I ate one piece of pie when I'm on a diet? Or is this just a natural, normal thing, and all you do is you say, okay, fine, I enjoyed that, but now I'm going to go back on my diet. That's really the rational response, rather than labeling yourself in that way. Because that actually make you feel so bad that you want more pie. Yeah, that's right? What's the data that would support your opinion? That this is the end of the world, I just lost my job, I'll never be able to eat again. What data supports that position that your thoughts? Now, these are automatic thoughts. Now, those of you who say, what does he mean by an automatic thought? What does he mean by that? That's what I'm talking about. That's the automatic thought, that thought, the little voice in the back of your head. They just pop up. And there's a reason why negative ones come up rather than positive ones. One thing you can do is to ask yourself, well, what does that mean? And you keep repeating that. So, for example, if we go back to the example of the student who failed an English test, and she's feeling horrible about it, and you say, well, what does that mean to you? Well, if I failed that test, I guess it means that I'll fail the course. Well, what would that mean to you? Well, if I fail the course, I guess I might have to drop out of college. Well, what does that mean to you? Well, then I won't be able to get a good job, and my parents will think that I'm stupid, and my friends will, and no one will want to be my friend. Well, what would that mean to you? I guess it means that I am stupid and I'm not lovable. Well, what does that mean? And so on. You can actually work your way down to the core problem that's behind it all, which is that I'm not lovable. The only way I can be loved is if I am incredibly successful, especially in academics, with my parents, for example. Now, this is a concept of why some people have certain negative thoughts, because underneath it is a belief, or what the therapists call a schema, that's developed usually in childhood, and you don't even know that's your worldview, but that's what is the ultimate driver for why flunking one test ends up with you not being a lovable person. And ask yourself if there's a better way, a more accurate way even to think about it. I failed one test. All I have to do is study harder and talk to the professor. What can I do? Is there any makeup work I can do to make up for it? So there are more rational and reasonable ways to deal with having failed one test. Another thing that's often a driver for some anxiety is should and must rules. You should do this, you must do that. My wife tells me there are no shoulds. There probably are some, but should and must often drive us crazy. And so here's an example that I was given when I was first learning about this. One prudent thing that some people would say is you should keep, say, a $20 bill rolled up inside of your wallet or your purse and always have that available, because you never know when you're going to be driving, somewhere and you start running real low on gas and, your credit card has been turned down. What are you going to do? Well, you're not going to worry. You're going to go to a gas station. You have $20 because you always have $20. You must have $20 in your wallet for things like that. But what happens when you go to that gas station and you spend the $20 on that and you get back in your car and you realize, I don't have $20 in my pocket and I must have $20 in my pocket. Now what happens? You become anxious. So should and must rules can rule you when they don't need to. You might better say, it would be good if I, or I would prefer if I. See, preferring things usually works better than having tos. Next slide. What do you do about some of these things? One of the most powerful words that some therapists use, and I've used it, is the word yet. So if someone is saying, well, I failed this test, so I know I'm not going to be successful in college, if you say to them something like, so you're not successful yet. See, the word yet implies there's a possibility, maybe even a reality, that it will be different than that. And if people don't recognize that their future can be different and that they have something to do with changing their future, that can actually shift people's response to some negative things in life. Yeah, you're not a full professor yet, and so on. And when you're trying to solve the problem, whether it's a financial one or whatever it is that's stressing you, it's good to have some specific goals in mind and then write down small steps that you would need to do to achieve that goal. And sometimes very small steps are what's needed. If you have too big steps, then it overwhelms you. So just small steps, and don't think about the whole thing to say, okay, the first step is this. So if you have to write a paper and you're feeling overwhelmed, what do I do? I'm not sure how to get started. Well, maybe the first thing to do is I have to turn on my computer. And the second thing I have to do is I have to go to the Word section and pull that up. And then I just need to put a title down. If you put it down in small steps, next thing you know, you're doing it. When you learn to deal with anxiety, what the psychologists have found is that it's not that you don't have as much fear, it's you have more courage. So now you have enough courage to overcome whatever it is that's making you anxious, which is sort of an interesting psychological thing. Another very potent thing for dealing with anxiety is exercise, and this we're talking primarily aerobic exercise like brisk walking, cycling, swimming, what have you. That actually helps to reduce both depression and anxiety and can actually be as effective as medications. Not everyone likes to exercise, not everyone can for physical reasons, but if you can, it can be a very powerful approach. Another thing to do would be deep breathing and focus, and we'll talk more about specific focus, but the deep breathing basically means that you're consciously taking a deep breath, holding it for a count of 4, and then very slowly exhaling it, and doing that repeatedly. That has an effect of reducing your heart rate and normalizing the rate rhythm. It affects a certain nerve called the vagus nerve that's influenced by this kind of breathing. It also helps reduce the stress response because your body thinks that, well, since you're able to breathe deeply and calmly like that and you have control over your breathing, then things must not be that bad. And so your cortisol level goes down, your dopamine level goes down, your norepinephrine goes down, and so you're not so shaky and sweaty and your heart's not pounding and so on. So deep breathing can be very powerful for helping with anxiety. Next slide. Another thing that some people find helpful is distraction. So you're feeling anxious, go and do something, especially something that will keep your mind off of whatever you're anxious about. And whether that's playing a game of solitaire on your computer or sewing something, whatever you find that can distract you from these thoughts that keep going through your mind and rolling them over and over again. Another one is called the Anxiety Rule 333. Oh, this is a form of distraction, actually. The three things you do is you see three things. So let's say I'm anxious now. So I'm going to look around here and see three things. So I see that thing hanging on the wall, says I make all things new. That's kind of cool. Okay, that's one. The second thing is, oh, I see Eric back there, and he's looking at me, frowning. No, he's just looking at me. And so that's two. And then the third thing is this pew, and it has a cross on it. Okay, so I've seen three things. Now I want to hear three things. I'm hearing my voice reverberating around the room. I'm hearing somebody breathing. So you do that for those three things. It turns out that seems to cut the anxious feeling back, and probably it's a distraction thing, because you're focusing on certain sensory experiences rather than the anxiety that's rattling around in your head. This next one is one of the most powerful ones, and that's being with other people. We're social creatures, not just any random person, but someone who cares about you, who helps it be supportive of you, who will listen to what you have to say, who's willing to be with you. That does not mean that you want to go to someone who's going to solve your problem that you're anxious about. They might be able to, but that's not what you should count on. Is you want someone who can listen and be a presence. Being present with someone is incredibly powerful. And we find that in medicine and nursing, and Ray knows all about that. Being with. Also, be happy if you're noticing incremental improvements. Instead of going from, I'm incredibly anxious to I'm not anxious at all, I'm just so relaxed. That might happen, but as long as you feel less anxious, and then incrementally get a little bit less anxious and keep working and make it better and better. Now, even though we're talking about normal everyday anxiety, it may be bad enough that you may benefit from receiving temporarily a minor tranquilizer like some Valium or something, and or going ahead and seeing a therapist who can work with you on your negative thoughts about the experience and help work it through. So, next slide. So that's everyday anxiety. I'm going to now talk about the pathological anxiety, the things that keep psychologists and psychiatrists busy. At the end, there'll be time for questions and comments, and I know I skip over a lot of things and make it pretty brief, but you can ask questions about any of these things. So next slide. It turns out children can be anxious. These are two forms of anxiety disorder that children have, and these are sort of specific diagnoses found in childhood. I'm not going to talk about them specifically, but just be aware that children can be anxious. They can also have generalized anxiety. They can be depressed, and they can also be suicidal at age 4 or 5. People don't often know that. Next slide. In adults, specific phobias, that's the most common anxiety disorder, and that means you're afraid of flying or snakes or high places or something like that. Social anxiety disorder, I saw that a lot in college students. They're now in class where they're expected to get up in front of the class and talk about some topic, and they're extremely anxious and find that very difficult. Panic disorder, where you have actual panic attacks that may wake you from sleep. They can occur out of the blue, or they can be triggered. And this is intense anxiety that lasts for a relatively short period of time, meaning a half an hour to a few hours. Agoraphobia, which is a Greek word that just means fear of the marketplace. What it refers to is being afraid to leave places that feel safe to you, like your home, and going out into public. So maybe you can't even go to a grocery store because there are people around. That's called agoraphobia, and it's very common with panic disorder. And partly it's because you're afraid you're going to have a panic attack in a public setting, and this would be very embarrassing and upsetting. So, next slide. Now, there are substances, that is to say drugs and medications, that can cause anxiety. I gave you an example of the stimulant experience that I had, but there are a lot of medicines that can cause anxiety and a lot of medical conditions that can. So those are those first two. I'm not going to talk about any of those, but again, if you have questions about one at the end, please feel free. But the one that's in the greatest bolding in the largest letters is why we'll talk about generalized anxiety disorder, which is the second most common after simple phobias. And generalized anxiety means that generalized is the fact that it can occur in all sorts of settings. It can happen out of the blue for no apparent reason, and you're just feeling anxious. And it can be triggered by minor things or have no triggers at all. You can wake up in the middle of the night with it. You may or may not recognize a nightmare associated with it, but that's what this disorder is. And it has to be bad enough that it interferes with your normal functioning, and or it's very distressing. So, next slide. So there are both mental and physical symptoms that occur with this kind of anxiety. So a fearfulness in your mind, feeling irritable, which is not good for others, restless, trouble sleeping, you can't focus, you can be argumentative, and you may not engage in usual activities because you're feeling too anxious. The next slide. So these are some of the physical symptoms. The first one is some people describe this sensation in their chest as like there were gerbils or rabbits or something running around in their chest. That's really more related to cardiac things that are just showing up as these sensations in your chest. A tremor, shaking. And by the way, if you really want to see if somebody's very tremulous, the way to do it is to magnify it. And so I have copies of my slides in case the electronics failed. But so imagine that I have anxiety. So now, instead of it being like that, it would be like this. See how that easier to see than, if you make. So I often will do that with a patient if I'm wondering if they have a tremor disorder, like from Parkinson's or, essential tremor disease or something like that. Sweating, GI upsets, particularly diarrhea, but also upset stomach, rapid pulse, elevated blood pressure, increased respirations, breathing faster, and there are a number of patients who used to come into my office as a family doctor who would be doing like that, and frequently it was not because they had COPD or asthma, they were having anxiety attack. And the problem with that is when you're breathing rapidly, what you're doing is you're breathing out excessive amounts of carbon dioxide. When you breathe in oxygen, you breathe out carbon dioxide. So carbon dioxide, though, when it's in your blood, is actually an acid. And so you're blowing off the acid, so you're making your blood more alkaline, which is not supposed to be. So when you change the blood's pH like that, it affects a lot of the minerals in your blood, including like calcium. And then when the calcium level goes down, then you start having tremors, and it makes you feel very, very bad. And so one of the treatments is you get a bag and have them breathe into it, so they're rebreathing some of that carbon dioxide, and they renormalize their pH level in their blood. So increased respirations is common with anxiety, and it can cause numbness and tingling around your mouth and fingers and so on. And that's is not harmful, it just doesn't feel good. And this last one, frequent urination, I put that in because it's also quite common. And again, if I had a nickel for every patient that came to see me as a family doctor who said, I started urinating an awful lot, and I don't know why, am I diabetic, if I have a urinary infection, so you test them, no, they're fine. You find out they're anxious. Anxiety is a common cause of increasing your frequency with which you find yourself going to the bathroom to pass urine. So it's good to know what the actual cause is so you can treat the right thing. Next slide. So what causes anxiety? Next slide. And we're talking here about the disorders. Genetics plays a substantial role. So if there's somebody, your great aunt or your sister or somebody else has anxiety problems, you have a much increased risk of having that yourself because of the genetics involved. Now there's also something called epigenetics, which is people may be less familiar with, but what genes do is they encode proteins. They say to the cells, make this protein at this time for this purpose. That's what the gene's telling your body. But it turns out your genes aren't continuously going. They are turned on and off, and sometimes they're turned on for the right reason and off for the right reason. But there are natural events, that is environmental events, things that can happen to you that turn them off or on when they're not supposed to be off or on. And that's a potential cause of a number of diseases. So for instance, if you grow up and you have a lot of very negative life experiences. There's a lot of violence in your home. You live in a neighborhood where the gunshots are going off. You are deprived of adequate nutrition, and so on. Those are epigenetic experiences will actually change your genetic expression. So it's not just the genes, it's whether they're turned on or off and when and how. So that's called epigenetics. So that's, if you will, a combination of the underlying genetics and then what the environment does. So we tend to think of there's nature as genetics and the environment as nurturing, how you're raised, what happens, how do you eat, and so on. And frequently people ask, well, is this condition nature or nurture? And it's almost always, with very few exceptions, both. So you may have a genetic risk of something, but it won't be manifest unless something happens environmentally to bring it out. And that could be true for anxiety or depression. There are tremendous genetic risks, but they may not occur if your environment is acting a certain way. And that includes both the epigenetics, how it makes the genes act, but also other more psychosomatic or psychological phenomena. Next slide. How common is it? You can see the prevalence there in adolescence. It goes up in adults, and women and adolescent girls have twice the rate as men and boys. That's the same statistic for depression. And it does appear to be hormonally related and other factors. It's not just that women are picked on more than men. That could be true, but it's not the cause of this. Next slide. Some people, when they have an anxiety disorder, will actually have suicidal thoughts. Next slide. We tend to think of suicide as being something related to depression, and that's frequently true. What hasn't been as well appreciated is anxious people also have an increased suicide risk. So they have more thoughts about suicide and they're more likely to behave suicidally. And the most common anxiety disorder that's diagnosed in people who are experiencing severe suicidal thinking or even attempted it is the disorder we're discussing now, which is generalized anxiety disorder. So if you have that, we need to keep a close eye on you for developing those kinds of thoughts. Next slide. So how do you treat generalized anxiety disorder? Next slide. So broadly speaking, it fits a couple of categories, and one are the talking therapies, the psychotherapy, and the other would be medications and more physiological things. So next slide. There are a number of forms of therapy that are very effective for anxiety disorders, but the one that's the best studied and has the most research on it that proves that it's highly effective is this cognitive behavioral therapy. So I thought I would discuss that more. I've brought it up in previous talks. But it really has to do with your thoughts, your feelings or emotions, and your actions, your behavior, what you do. And one of the key notions is that how we feel in the here and now is heavily influenced by what we're thinking. So as an example of that, imagine that you're standing on a street corner in a city and you see a good friend of yours that you haven't spoken to in a good while across the street. She's walking along the street. You wave at her and you yell out her name and she doesn't look at you, she doesn't turn around, and what your thought is, she's ignoring me. I wonder what I did wrong. If she's ignoring me like this, maybe she's not going to be my friend anymore. In fact, maybe no one will really want to be my friend because she was always a good friend. If she doesn't want to be my friend, no one will. In fact, I will always be friendless. Now, this is a series of thoughts that people prone to depression and anxiety can have. That's an exaggerated amount, but that's kind of what can happen. Imagine if you have a thought like that, how you would feel. You would feel either anxious or depressed or both. And that was based upon what you thought. Because if you rewind the tape and you see your good friend you haven't talked to in a while walking down the street and you call her name, you wave at her and she doesn't look at you, she doesn't turn around, she doesn't respond, if you say, oh, I guess she didn't hear me, well, you might be disappointed, but you would likely not be depressed or anxious, right? So it's just the difference in what you thought about the event, not the event itself. It's what do you think about the events in your life drives how you feel about them. And unfortunately, those who are prone to depression and anxiety tend to have a lot more negative thoughts about life events than people who are not so prone. So again, it gets back to that voice in the back of your head we talked about before. And so what I mentioned was underlying why you're having these negative thoughts when someone else with the same experience doesn't, has to do with underlying beliefs about yourself, the world, or the future, also technically called schemas. In fact, there's something called schema therapy. When you go beyond just how do we deal with these thoughts, but why are they happening? And it just takes more time, and the therapists need to be trained in that too. And it requires a trained therapist. So what's an example of an underlying belief that might drive this? So let's imagine that you're a little girl, and in your household, for whatever reason, your parents tend to blame you whenever anything bad happens. So the vase has fallen over and broken. What did you do? You were playing around. I tell you, it turned out you had nothing to do with it. It was the cat that did it, but you get blamed. And this is your constant message that you're getting from your parents. If something bad happens, it's your fault. Now imagine that you're 22 years old, and you've got this belief in the back of your head that you don't really recognize it as a belief, but it's in there. Something bad happens, must be my fault. Now you're married, you get pregnant, you're excited, you're happy, you're thrilled, you have a miscarriage. How will you react? What did I do? I forgot to take my vitamin that one day. You come up with all sorts of things that you did to cause this to happen, and you're blaming yourself because why? If something bad happens, guess what? It's your fault. So you're thinking about how is that? And every obstetrician will tell you missing your pill one time does not cause a miscarriage, but you don't know that. So you have this belief, something bad happens, it's my fault, I have a miscarriage, I did this, I don't know how, I'm trying to think it through so it won't happen again. That's an example of an underlying belief that drives those kinds of negative thoughts. So if you really want to get at it, ultimately you have to find out what are your underlying beliefs and your schemas, if you want to call them that. And there are also techniques, therapists who do this can help you to change these beliefs. You know, okay, so now we get it, that when you were a child, that's what it was. Now you're an adult. How do we shift the way you think about when bad things happen? And usually cognitive behavioral therapy, just so you know, for anxiety, lasts about 12 to 15 one-hour weekly sessions. So it's not like this forever lying on a sofa and just thinking up things you want to say to them. It's a very specific and organized form of treatment. Next slide. Again, some other cognitive distortions. If something positive happens in your life, that doesn't count for some reason. Overgeneralizing. Mind reading, by the way, is a big one that gets people in trouble in their relationships. You imagine that you can read your boyfriend or girlfriend's mind, or your husband or your wife's mind, or your child's mind. What are they thinking? You think you know what they're thinking. Or conversely, people think that you should know what they're thinking. Like, well, how come you seem to be so angry at me? Well, you should know. Well, maybe, but I don't. Why don't you tell me? I can't read your mind. And here's a secret, by the way, psychiatrists can't read your mind either, so don't worry about that. Fortune telling is another one. That's being able to read into the future. That's where, you know, you flunked the one test, so you know you're going to be a miserable failure in the world. That's a fortune-telling error. Negatively labeling yourself, we did talk about that already, like calling yourself a pig or I'm stupid or whatever. And so there's a way that you would deal with any one of those if you're working with a therapist. Now you can learn a lot about it too if you read about it. There are a number of books on cognitive behavioral therapy, and you can actually give yourself some self-treatment. You see, oh, here's how you deal with when you're fortune-telling. This is the approach to overcoming that. Next slide. These are the examples of some underlying beliefs or schemas that have driven people to have a lot of negative thoughts. We did talk about that third one. Next slide. Another approach to dealing with generalized anxiety disorder would benefit from having someone trained in this, but to use mindfulness. It was actually introduced in the United States years ago to deal with people with chronic pain, and it turned out to be very effective for that, improving that. And it was found to be very effective for a number of other things, including anxiety disorders like generalized anxiety disorder. Essentially what it comes down to is a type of meditation, if you will, but it's very conscious and deliberate. So what you're doing is you're going to focus on your immediate sensory experience. What are you hearing, seeing, feeling, smelling, tasting, and so on? You start with what they call beginner's mind. In other words, act as if you're a child and you've never experienced this before. So sometimes when they're training, they'll take out a raisin and they'll give everybody a raisin. I want you to look at it, to smell it, to feel it, taste it, and act as if, in your mind, as if you've never seen, tasted, or felt a raisin before. And be curious about it, the way a child would go, oh, this leaf is so interesting, approaching it that way. And your focus is on the sensory experience and what you're noticing rather than your thoughts. And thoughts will come into your mind, and you're supposed to just kind of let them be there and let them go. Don't say, wonder why I thought that. No, just let them come and go. And you learn a breathing technique. It's a slow breathing method. There are several you can do to help keep the anxiety down. And do deep muscle relaxation, where you make yourself like a rag doll. Your arms and loose, and all your muscles, particularly the muscles here in the jaw. That's kind of when you're really anxious, your jaw muscles tend to get tight. So if you can relax those and then the muscles in your head, you'll often feel much less stressed and anxious. And so that's a conscious process. And mindfulness has been found to be very helpful for people with anxiety disorders. Next slide. Other things will be dependent partly on your age and your situation. For children, they found that educating in particular, but also if the child's old enough to explain to them what's going on with them and what they can do. There's actually a process called My Magic Mind for kids ages 8 to 12 that's been very effective to help them with their anxious children. Family focus therapy is also very effective rather than just trying to do therapy with the child, though when you do that, it's really with play therapy, we call it. And you want to really do all these sorts of things before you consider medicating children, but sometimes you have to. Next slide. The second broad speaking way to deal with anxiety treatments is to give medication. And there are a number of them that can be used for anxiety disorders. Next slide. The first choice for generalized anxiety disorder would be to use an SSRI, a selective serotonin reuptake inhibitor. That just means a medicine that makes more of this neurochemical available that communicates between one nerve and the next nerve. And by raising that level, the communication increases and it helps reduce anxiety, also reduces depression. And a great example of that is the medication sertraline, is the generic name, Zoloft is the common trade name. And it seems to be particularly good among the SSRIs for anxiety. If that medicine doesn't work, if you take it at a high enough dose for a long enough time and it's not working well enough, you might then move on to the next one is an SNRI. So it's like the selective serotonin. It does do that, but it also increases the availability of norepinephrine. So it's a different neurotransmitter. Both of them are increased in availability in the brain with this type of medication, and sometimes that dual mechanism is more effective than the SSRI alone. And then the last one I'll mention is buspirone. That's a generic name. Buspar is the common trade name. And it is an anti-anxiety agent. It has a very complex mechanism of action that I won't go into. Thank you very much. It can be used either alone or sometimes with one other medication, one or more of the other medications. You just have to be careful because it also does something to serotonin. You don't want too much serotonin available. That can make you sick. So those are the three categories of medicines that we usually would start with for dealing with generalized anxiety disorder. Next slide. If that's not working well enough, but if you're getting some benefit, for example, from them, then you may want to continue those, but then if they're not getting therapy, start them on CBT therapy as well. That combination is the most powerful thing to do, is get both talking therapy and the medication at the same time. There are some other medications that can be used. One is called pregabalin. It's used for a lot of things. It can help reduce pain from like diabetic neuropathies. If you have fibromyalgia, it can be used. It can be used for certain kinds of seizures. It has a lot of different uses, but one of them is reducing anxiety. The only challenge with it and why we don't use it as a first line is it can be a little bit addictive for some people. So you just have to be careful with it. And that's kind of true for the next level one. It's called benzodiazepines. That's the Xanaxes of the world, if you will. Clonazepam, there are a lot of them. They have different lengths. They all do basically the same thing. They're minor tranquilizers, and they can be highly effective in reducing generalized anxiety disorder. The challenge is that they too can be a bit, I hate to overemphasize this, so that's why I hesitate how to put it exactly, but some people do get addicted. But that's exaggerated as to how often that happens. What's more likely to happen, which means basically your body has become sufficiently used to it, you may need a higher dose to be effective. But you're not addicted to it, meaning you don't take extra ones or anything like that. But it does happen, and so the user recommendation is if they need, put them on it, but hopefully it's short term, just to get them over a hump, and they're going to take something the rest of their life. And then the last one that I have up here are called beta blockers. The best example of that would be Inderal or propranolol, the generic name rather. LA just means it's long acting. They also have shorter acting ones. What this does, it doesn't really attack anxiety per se, but what it does is it reduces those physical manifestations of anxiety we talked about before, the tremor, the heart pounding, the high blood pressure, that sort of thing. It prevents those from happening, so you don't have the physical sensations of being anxious, which actually makes you feel mentally less anxious. So they can be very helpful as an adjunctive treatment. I would say they're used mostly in terms of anxiety for people who have some kind of performance anxiety. Like they are learning to play a musical instrument, now they're going to have to give a concert in front of the whole class, and they're so afraid they can hardly function. So you give them one of these beta blockers an hour beforehand, and now they're not shaking and everything, and they feel more comfortable and they can do it. So it's good for performance anxiety. But it can also be an adjunctive help for generalized anxiety disorder. Next slide. If none of that works, then we say we'll refer to a psychiatrist. Partly that's to get more sophistication about the medication use, but also other forms of treatment. And one big example here is repetitive transcranial magnetic stimulation. Next slide. This is a picture of a man receiving the treatment. It's an outpatient procedure. You don't have anesthesia given, so you can drive yourself there and back. Each session lasts about 20 minutes. And you're seated like this, and they have this machine. And the thing that's on the left side of his head, so when you're looking at it, it's on the right, your right side, is actually a magnet, not very powerful. And the other device hold his head steady. And what it does is it gives repeated pulses of electromagnetism to the brain that's set in a particular place. And what that does is sort of scrambles the electrical signals a little bit, and then they readjust, and they are normalized. And this is a very powerful and effective and very safe treatment for both depression and anxiety, generalized anxiety disorder. It's more expensive than taking, so it's not the first choice of treatment, but it can be very, very effective. Next slide. There are other adjunctive treatments for generalized anxiety disorder. One is, of course, psychological education is always important for whatever someone has. I think if you have an illness of any kind, you should become the world's expert on it because it's your experience better. So education about it is very so that you understand it and what you should do under certain circumstances. Lifestyle education, we already talked about the importance about eating right, sleeping right, and so on. Turns out yoga can be a very powerful adjunctive treatment for anxiety. Again, we're focusing on generalized anxiety disorder. Massage has been shown, this is the massage that's done for relaxation, can be as effective for some people as medication for treating generalized anxiety disorder. And acupuncture, when it's done correctly and by people who are trained in and knowledgeable about it, can also be very helpful for anxiety. And I had mentioned it previously, and perhaps I could have put it back in here again, the importance of exercise is a very powerful thing. It'll help burn up the adrenaline and noradrenaline that's being produced, and it raises your natural endorphins, which is your body's own natural morphine in your brain, so it makes you feel better and happier and so on. So exercise is very, very helpful and important adjunctive treatment. Next slide. So with that, we're going to open up for questions, and you can also make comments. The only rule about the questions is you cannot ask me hard questions. They all have to be easy, okay? That's the only rule with that. And then the last slide, I do have a, next slide, I do have a blog that I do. It's on general healthcare topics. That's how you would access if you're curious about that. I do one every week or two. I have over 200 of them. They're all available to see. It doesn't cost anything. Just type that into your finders, and it'll take you to that site, and you can see them. So, anybody have the microphone that they should share around, or just people have to talk loudly? Because I don't hear that well. Yes, ma'am.
I wondered, the one medication you mentioned, is that the same as gabapentin?
So let me answer your question, but also tell people what you, in case they didn't hear it, because we don't have a phone for you. She's asking whether that medicine I mentioned, the pregabalin, is that same thing as gabapentin. And it's a derivative of gabapentin, yeah. So they're cousins or whatever you want to think. But we can use gabapentin, but we usually prefer pregabalin purpose. Yeah. Yeah. You want to hand it to whoever has a question, if anyone does, or a comment anyone wants to make?
Come on.
Yeah.
You used to be afraid of public speaking, but not any longer. And, when you were talking about, what was that, the one where you hurt yourself or something? Well, let me just give you the example, then you probably can tell me.
Yeah.
When I was a flight attendant, I was very young, and I had an all-nighter flight. I flew these all-nighters, and I was talking to this man. The other people were sleeping. And I was really beating myself up verbally to him. And this affected me. He said, "Why are you stabbing yourself?" That's what he said to me. And it just, because I kept talking badly about myself.
Yeah.
So what would you call that? What was that?
So do you mean literally stabbing yourself with
Well,
something, or just
With
verbally?
my verbal talking to
stabbing
this
yourself.
man
Okay.
on an all-nighter. We were just talking, and
Yeah,
whatever
yeah.
I was saying, I was like,
Yeah.
and he said, "Why are you stabbing yourself?" Like
Yeah.
maybe I said I was a pig, or I was talking badly.
Yeah. So that's an example of labeling. You're labeling
Oh, that's
yourself,
right.
okay?
Yeah.
Now, the reason I asked about actually stabbing yourself is because people do that, and it's called suicidal self-injury. It's actually a real thing. It's common among people who have borderline personality disorder. They will pinch themselves, stab themselves, cut themselves. It's a way of trying to relieve bad feelings. It's not a good thing to do.
Yeah, it kind of was like that.
It's a real thing like that. So that's why I wasn't sure what you were
Yeah,
saying.
yeah, thank you.
So that would be labeling.
I never did that. I did it verbally, but
Yeah, that's
the
bad,
wonderful
too.
thing, through my growth with the Lord,
Yeah.
I think it's 2 Corinthians 10:5, I'm not sure, but it says, "Take every thought captive into the obedience of Christ and cast down those vain imaginations that exalt itself against the knowledge of God." So as I've grown in the Lord since that time till now, my elderly stage, it's so sweet because the Holy Spirit truly, if those ideas or thoughts fly through, like you were saying, I take them captive and I line it up to what the Word tells me. The Word tells me I'm loved, those things. So that's what I would say.
Yeah, no, I know that's not intended as therapy in quotes, but it does. There's tremendous psychological benefits to prayer and religious belief. Even if there was no such thing as religion, we should have one to feel better. The research on that is absolutely clear about the benefits to us physically and mentally. You would want it even if it didn't exist. Unfortunately, it does. You get double for your time. So, yeah.
My cure for anxiety is turn the TV off.
I wondered if, say you have anxiety, everyday anxiety, and maybe you even have an anxiety disorder, but it has not been diagnosed.
Yeah.
how effective is mindfulness, the practice of doing all of those things to deal with the anxiety?
Yeah, well, mindfulness can be a very powerful and effective thing. You can try it on your own just by reading about it. I had the opportunity to take a course on it for psychiatrists to then use with patients. And the reason why we had it is because it is so effective even for the pathological form of anxiety. But it can be used for ordinary anxiety or pathologic anxiety. It does take some practice. And if you try it on your own and it's not doing that much, it may be that you're just not quite doing it exactly the optimal way. So if you can find a mindfulness therapist, that can be very helpful. And mindfulness can be done at any time. There's a form of walking mindfulness where you don't keep your eyes closed. Other times you sit down, you can close your eyes so you're not distracted and you focus on sensations and that sort of thing. One of the favorite places a lot of people have is doing it in the shower because there are lots of sensory things that are happening. The sounds of the water, the feeling in your body, the temperature changes, the smell of the soap, and on and on. And if you focus on those things rather than the stuff that runs through your head all the time, that can really settle it down. Another time to do it is when you're eating. It's called mindful eating. A lot of us seemingly are in a hurry for some reason, shovel the food in and swallow it right down without even really tasting it or chewing it thoroughly. And the problem is then you're not even enjoying your food, really. You're just putting food in your body. Now, you need food, so that's okay. But imagine if you took your time and chewed slowly and noticed the sensory experience of it. Focus more on the taste and the smells of the food and the texture. Oh, that's kind of crunchy. And just notice more. It turns out you won't eat as much and you'll enjoy it more. So mindfulness is a very helpful and powerful technique. Linda, do you have? Oh, sorry. He'll get to you. Next. Yeah. Yeah.
I know whenever I was a nurse, we had several patients, and it wasn't the field, but for cutting. Mm-hmm. And it seems like it's so prevalent in the junior high and high school that I have seen or heard. How would you advise the parents, especially if they're like in denial, as far as like what is the first step that you would advise somebody to do?
Advice to the parents? Yeah. And who's in denial, the student or the parents or both? The parents are, yeah. Well, ideally, they would be able to see a therapist for themselves or a psychiatrist. But sometimes your family doctor or even a pediatrician might be able to know enough about it to give you some advice. It's not a healthy thing, clearly. It can lead to physical problems like infections and what have you. They may cut too deeply by accident and cut a vessel or something. But it's also, they're doing it to try to relieve a bad feeling. And it does help with that. That's why they may continue doing it. But that's not an optimal way to deal with it. They need to get at what's causing that, and there are other safer ways to do it. So this is basically what I would provide that as kind of what we call psychoeducation to the parents. Hey, they're doing that. It's not a safe way. There are more effective ways. It would be good if we could get your daughter or son into treatment so that they could learn more effective, safer ways of dealing with their bad feelings. Okay.
You mentioned genetics. Does that mean that it could be hereditary?
That's exactly what it means, yes. People who are prone to generalized anxiety disorder, same thing with people prone to depression, have a genetic basis for that. It's very complex. It's not like eye color where it's one gene. There are about 100 different genes that are involved with those kinds of disorders. And so it's a little bit of a contribution from each one that adds up to the risk. And that's part of the reason perhaps why it may take some environmental factor to trigger it. So it's not just enough to have the risk of getting that. You have to have the environmental factor. And that can be true for any physical illness too, like diabetes or whatever. If you're genetically prone to diabetes, but you're always keeping your weight down and you're eating properly and all that, you may never get it. So.
Is guided imagery a technique that can help with anxiety?
Yes, guided imagery can be helpful for that. And it's really, in my mind, kind of just a variant of the mindfulness, but it's sort of guided as to what your imagery, but then you're kind of mindfully focusing on that.
I used to
Yeah.
utilize that with relaxation
Yeah,
techniques.
yeah, exactly. These are all very similar things. In fact, what people don't appreciate, I studied hypnosis for a while, and hypnosis is very much those same things. It's just that you have someone who's trained who's walking you through the steps of focused concentration. So, people want to go to the game? Okay, go ahead. Yeah. No.
I just wondered with the current situation, you know, with politics and, you know, talking to people with different feelings, any strategies to try to reduce conflict and how to manage that stress?
Yeah,
How
so
to
you
make-
talk about the political
Right.
stress
mean,
that
with our
the
country
psychologists are noticing. I wish I had a magical solution, but I have some suggestions. There are two philosophy professors at a university, I don't remember which one, who were looking at this political conflict that we're going through that seems more powerful recently than it has been in past years. We've always had differences of opinion about right and left and that sort of thing.
Media.
What they are encouraging us to do, they're using technical language in philosophy of epistemic humility. Epistemic means how do we know something? And what they're saying is be more humble about what you think you know. So you're absolutely convinced that your political perspective is the right one, and they are so far off that they should jump off a cliff. But they think the same thing about you. Well, you both can't be right. So why not be more humble about it and say, let me try to understand where they're coming from. And there's actually good research on the psychological and social differences between right and left, for example. It turns out they both have a different set of values that if you heard of the values just on themselves, you say, those are all good values. But the emphasis is different. And that's what's driving us apart, is what we're focused on in terms of our value sets. But if we understood what value the other person is coming from and why they're doing that, and listen non-judgmentally at first, we then could perhaps get better understanding. It doesn't mean you have to change each other's minds, but we can become more accepting of one another. And maybe you might even discover I didn't even know they thought of it that way, but that makes sense to me. You might even shift the way you think a little bit yourself. But I think we're sort of stuck with thinking black and white, all or nothing, which is actually considered a cognitive distortion by CBT therapists. It's all or nothing. It's either all good or it's all bad. And most of the time, life is a little more gray than that. So, yeah, you look like you want to say something. Get the microphone there.
Peter, you know I'm going to have to add to this.
Yeah.
So one of my things that goes through my mind, yes, I have anxiety, and I'm sure some folks in here have it.
One or
But
two.
What helps me the most is when I can identify it. Once I have identified it, then I can work with it.
Yeah.
And I think a lot of us are unable to identify it at the time.
Yeah.
And then we can take those measures of large muscle moving type activities to help eliminate that.
Yeah. Yeah.
So that was one of my own personal problems, was
Yeah.
being able to identify it. Next question. How is PTSD tied into anxiety? And that's a tough question. You don't have to answer it if you don't want to.
Yeah, yeah. So how is PTSD tied into anxiety? So it is considered an anxiety type of disorder, but it's in its own category, and partly because of its intensity and its specificity. You can't have that unless you experienced or observed a violent event, either emotionally or physically, usually physically violent event that anyone would find very disturbing, such as being in a war zone and the guy next to you has his head literally blown off next to you, or just being a rape victim in a city or something like that. So you have to have an event of that sort that would be extremely disturbing to anyone, but you're reacting to it in a way that's excessive, if you want to call it that, where you know, you can't sleep, you have severe dreams and nightmares, you have flashbacks to the event that are triggered by, you know, if it was a war situation, the car backfires and you're hiding behind a bush because you think you're back in combat again. So there are those sort of specific things to PTSD. So it's been given its own category, but it is in the anxiety grouping.
I think I understand where he's coming from, because when you're talking about nature and nurture,
Mm-hmm.
if you're subjected to something over a long period of time, like your childhood,
Yeah.
that could almost equate to a PST, situation where you
Yeah.
were acting the same, but you don't really understand why, unlike
Right.
you were in combat and you can say
mhm.
you're flashing back to that,
Yeah.
rather than flashing back to 12 years of being in a violent
Right.
home situation.
Yes, no, you can have PTSD that's over time as well, yeah. But it has to meet those certain criteria to label it that, but you're absolutely right.
So anxiety is like worry? Or not? What about these hurricanes? I usually deal with stress pretty well,
Mm-hmm.
but after multiple hurricanes and knowing what can happen,
Yeah.
when the big ones are coming at us, I
Mhm.
find my anxiety
Yeah,
and stress level goes up.
yeah,
You know, almost to the point where, okay, I want to see the next update because I want to, and then, you know,
Right, right.
it varies.
Yeah,
And they
yeah.
tell you, don't watch them because of
Right,
the windshield wiper effect. But
yeah.
so does
Well-
does anxiety layer itself? I'm anxious about this, and now I got this other event. Now I'm anxious about that, and then there's this other thing over there. So they layer and build up, or are they each their own?
Yeah, no,
Issue.
yeah, they do layer, and that's an example of normal anxiety, or what I call ordinary anxiety. You should be probably a bit anxious about a hurricane coming, because, you know, it's a very dangerous situation and it can have serious consequences. Now, how much you should worry, well, that's going to vary partially on what the level of risk is. If it's a level 1 hurricane and it's going to hit 1,000 miles from you, you probably shouldn't be as worried as if it's a category 5 coming straight at you and you're in the water. You know, in other words, there's reality checking that needs to go with that as to how much anxiety should be reasonably expected with that. But if you're worried about a hurricane coming, but you also just lost your job, and by the way, your wife is after you for something, it adds up. Yeah, for sure. And so you have to decide whether it's manageable or not. And even if it's understandable, but you're having trouble managing it, you're not sleeping well, you feel like it's adversely affecting your life in some way, it's worth.
Kind of transitory because
Yeah,
when the real danger is no longer prevalent, then it's gone.
yeah, well, then that's
That's
normal.
normal.
And you may not, but what you might want to do when it's going to happen is don't be alone. Seek
Right.
input from others, take reasonable, rational steps for dealing with it. Should I leave town or
I just-
stay? And
I
so
use a
on.
hurricane as an example because we all just went through
Yeah,
several
yeah.
of them. And
Absolutely,
I was
yeah.
always taught over-prepare and be thankful.
Mhm.
That's what I did.
The other thing that you just brought up that comes across my mind is group anxiety. Look how many people were in the grocery stores, and look how many people were in gas stations. Some of the gas stations had to have sheriff's departments.
Right.
Okay, so this, to me, is group anxiety because of this situation over here.
Right.
Yeah, yeah.
So,
Well, I've often said, and I'm not the only one who says it, but the only thing that's more contagious than measles is anxiety. Seriously, if you're around an anxious person, you may find yourself starting to feel anxious because you kind of get your mirror neurons in your brain are firing, saying, "Oh, I'm starting to feel anxious." So yeah, we definitely make each other anxious. And no.
Well, also, we take on, or I do, and most of us do, the concern for what's going on in terms of the weather in other countries,
Oh, yeah, right.
in our own country, fires,
Mhm.
floods, hurricanes. I mean,
Yeah.
someone said, I'm going to move to another state. Well, where? I mean, every state has something, has an
Yeah.
environmental problem, a huge problem. So, I don't know, you take on
yeah.
is going on in the nature that we can't do anything about.
Yeah. Well, if you're a very empathic person and, you identify with their challenge and problem, you can actually start taking on the feelings that as if it's happening to you. You just don't want it to overwhelm you. So if you find yourself being too empathic to you might want to think about, is there another way to think about it?
So when we worry all about this, we pray to God. What'd you say? So when our anxiety levels and our worries are up so high, we pray to God.
You can even start a little before you get to that point.
On that same thought, I have a go-to phrase when I get anxious about something. I just say, I let go and I let God, and it helps. And being positive helps. I'm so tired today. No, you're not. Get up and go. I mean, that helps me.
Yeah.
I have a sign in my bedroom, says,
Mhm.
"To God, go to sleep."
Oh, I like that.
About a month ago, or a month before the hurricane, let's say August, I like the BBN radio station. Some of you, I think, listen to it. And I heard this man share something that Oswald Chambers, who was a minister of the gospel, he died young, I didn't know that, but he had a great devotional called My Utmost for His Highest. And he was saying something, and it hit my spirit when I heard it, and I just meditated on it quite a bit. And what Oswald had said was, trust God and do the next thing. And that hit my spirit, and then the hurricane came, and then I got a lot of the results of that, and I'm still trusting God and doing the next thing. However, I have had meltdowns and things like that, but I do keep my eyes on the Lord, and He's so sweet to hold me close. So, and all my brethren here, oh my goodness, thank you.
Yep, very good. It's after the you stay, but don't feel embarrassed if you have something else you want to or need to go to. Yeah. But I'll hang. We're done. What? Oh, private sessions. Yeah. Well, I am not licensed anymore, so. Thank you.
Thank you, Dr. Hartmann. Okay, bonus joke. Through all the